lithium toxicity. So you are FY2, you're FY2 in A&E. Okay. Patient is Jordan, age 70, has been brought in by his son to the hospital with tremors and difficulty in coordination. Okay. He has been on lithium for the bipolar disorder. Talk to the son and address his concern. Okay, fine. So now what you have, how can I help you? My dad is having tremors and having trouble in walking as well. So you may have a scenario where you may have a station where you will see the patient is giving you 2, 3 symptoms in one go. So obviously, if there are many symptoms, I can ask which symptom is bothering you the most. That is what I can do. That's number one. And but if there are two symptoms only, obviously you can have two main symptoms. So I will elaborate them one by one. Now, how can I help you? My dad is having tremors and trouble walking. I know a lot of us, what we do, we ask the patient, could you please tell me more? Be a bit specific. Tell me more about his tremors. Let's elaborate the tremor first. Once you're done with the elaboration of tremors, then you say, okay, so you also mentioned about trouble walking. Tell me more about it. So this is much better way of elaboration of the presenting complaint rather than just saying, tell me more. As a patient, I'm like, tell me more about tremor or about trouble walking or about both. I'm not feeling very comfortable as a patient. Right? So as a doctor, make sure you ask very much specifically. Okay, so I would say, tell me more about the tremors. Like for how long he's having it? Is there anything makes it worse? Anything makes it better? Is it continuously there? Is it comes and goes? Right. So all those things I can ask. Right. Then trouble walking. So I can ask about that as well. Trouble walking for how long? Anything makes it worse or better? Is it like when he stand up all of a sudden? Is that when he's getting the trouble with walking, or is it every time it's there? Any weakness, any slurred speech, any unsteadiness, gait problem? If he had a fall in the last few days or not? So all those questions I'll ask. So I'll elaborate tremors. I'll elaborate this trouble walking as well. So I'll elaborate the presenting complaint nicely. Fine. Another thing I've been given in the question, that patient is on lithium for bipolar disorder. So I can see the notes that your father has been diagnosed with bipolar disorder and is taking lithium. Yes. Now check the compliance, if he's taking it properly or not. So is he taking it regularly as prescribed? That is main thing. Regularly as prescribed. By any chance, any missed dose or not? And if he's going for regular blood checks or not? See, lithium is not a straightforward medication. It has got a lot of problems with it, right? So we have to check the blood levels. We have to have regular blood level checks as well for lithium. So ask if we have done all those things or not. All right. Anytime, whenever the patient is on any medication, we check the compliance, and then what we check? We check if there is any side effects or not because of this medication. So I will ask the patient if they have got any nausea, vomiting, any diarrhea, excessive thirst, or polyuria, any headache, any blurring of vision, right? So all those things. These are the side effects of lithium. Now, patient is taking it for what? For bipolar. So how's your mood? How's your mood? Anxious, irritable? Ask couple of questions for that as well. Right? So it's easy. So what we are doing, to be honest, question is telling you everything. First thing I did elaborate about tremors. Second, I did elaborate about difficulty in coordination. Third, I just checked the patient compliance about lithium. Fourth, I did check if patient is having side effects of lithium. Next, I just checked if the patient bipolar disorder, patient is having any more symptoms for it or not. That's pretty easy, right? So quick past personal history, that is what you can do. Sometimes the patient says that my father is diagnosed case of hypertension for last 10 years. Okay, so which medication is taking? Is he taking it regularly as prescribed or not? And if it is well controlled or not, right? So all those things you need to ask. Okay, I'm gonna check the vitals, general physical examination, and do neurological examination, doing some blood test, and lithium levels you need to check. That is the main thing. And then we'll say like what we're suspecting is the symptoms that you are mentioning. It could be because of high levels of lithium in the body. So this is what we can suspect. So now what we have to do, we are in which department? A&E. So definitely you will keep the patient in the hospital. And what is the treatment? Number one is discontinue lithium. That's the one thing. When I'm discontinuing lithium, I have to involve the psychiatrist as well, right? So you have to have the specialist for it because you're stopping lithium. So patient bipolar disorder also we have to manage. So the psychiatrist will come and they will be able to see what I can manage. Okay. Uh, IV fluids, that's what we can give it to the patient. Gastric lavage is not like done routinely, but for example, patient is having bipolar disorder and they might have taken too much of lithium in one go. In that case, maybe gastric lavage or hemodialysis can be done as well. Mainly the treatment would be discontinue lithium and go for IV fluids. It depends on the symptoms. If the symptoms are mild or severe symptoms, mild, we might be going for stopping lithium and IV fluid, it should be okay. But if patient has taken recently a high dose of lithium, maybe we have to go for gastric lavage and hemodialysis as well. And regular blood monitoring, that is what you have to do. That is the treatment plan. But there is something that you need to suggest to the patient or the son here, that how we can prevent it from happening in the future. So prevention of lithium toxicity. Number one, make sure you attend your scheduled blood test. Do not miss anything. So once we're done with the blood test, if you need to make any changes in the medications and all, the dosage and all, we can do that. Gradually reduce salt intake. That is really important. So what happens is, when somebody diagnosed with some medical problem, from the next day they feel like I should be having all healthy things in my diet and everything. So you will see a lot of patients, they will all of a sudden will drop their sugar intake, will drop their salt intake. So that can happen. But we tell these patients, so you have to be very careful. Gradually reduce the salt intake. Why? This is very important. Low sodium can increase lithium level in your body. So that's very important. Yeah. Make sure you stay hydrated because if you're not having enough water, that can be a reason of lithium toxicity. That's why the treatment here is IV fluids only. Yeah. So stay hydrated, especially during exercise and hot weather. Limit alcohol, avoid dehydration. In hot condition, inform doctors, pharmacists of about lithium before you take any new medications. So there's some general advices and something that you can do to prevent this lithium toxicity from happening. Right, so that's really, really, really important. So lithium toxicity, I think the history is going to be pretty easy. Elaborate your presenting complaint, check the compliance, check the side effect of the medication, ask a couple of questions about bipolar disorder, and that's it. That is it. So that's what we have got in a scenario of lithium toxicity. All right.